Depression. This presentation is an exploration of depression. Working definitions of depression and the neurotransmitter theory will be provided. How the potential drug treatments affect neurotransmitters, sample drugs and their functions, as well as the risk-benefits will be reviewed. The question of whether or not to use drugs will be considered, as well as alternate treatment options. Depression is a persistent state of loss, grief, or sadness that results in an inability or lack of desire to partake in usual daily activities. Symptoms of depression involve anxiety, stress, fatigue, mood swings, inability to focus, excessive change in appetites, which includes withdrawals or binging, excessive change in sleep patterns, meaning insomnia or constant sleep, and more. Depression is believed to be caused by a depletion or deficit of serotonin, dopamine, and norepinephrine within the central nervous system, also referred to as the monoamine deficiency theory. There are four classes of drugs utilized for the treatment of depression. Selective serotonin reuptake inhibitors increases serotonin while blocking reabsorption in the brain, which eases depressive symptoms. Norepinephrine and dopamine reuptake inhibitors cause the presynaptic release of norepinephrine and dopamine, which elevates one's moods. Anxiolytics cause the activation of gamma-aminobutyric acid, which releases anxiety and acts as a sleep aid. Antipsychotics block dopamine's D2 receptors, which reduces and improves psychiatric symptoms. The risks of utilizing medication to treat depression are the unpleasant side effects from ingesting the medication. The benefits of utilizing the medication to treat depression is some degree of relief of some or all of the associated symptoms. To drug or not to drug? Depression presents uniquely in each individual. One must consider whether or not the use of drugs is in the individual's best interest. In consideration, the rate of success on drugs, incidence of side effects, and the mortality associated with drug use are factors. Using drugs is seemingly most successful when combined in polysubstance or with cognitive behavioral therapy. May cause mild to severe side effects, including heart, kidney, and/or liver damage. It may increase suicidal ideations or psychotic episodes if not taken correctly. Contrarily, not using drugs may mean that the illness is left untreated, which may allow depression to worsen, resulting in further isolation and other symptoms. Risk of suicide may increase, and an alternate treatments may not yield desired results, which may increase symptoms. Age, culture, overall health, and academic status all play a part in the natural course of depression. Depression can range anywhere from a few months to many years to throughout a lifetime. On average, a bout of depression lasts approximately 6 to 8 months. Individuals experiencing depression may, without warning, go into remission. Once experienced, the risk of reoccurrence is greater. Abnormalities in the brain may remain unresolved. There are many unreported cases of depression each year due to the sufferers not seeking treatment. This phenomenon may skew statistical information. The length of time that illness exists increases the risk of the individual acting out suicidal ideations. Several alternate treatments exist that do not utilize medicine or drugs to alleviate depression. Electroconvulsive therapy, cognitive behavioral therapy, herbal supplements, and fitness training. In conclusion, Depression is a widespread illness that has a specific physiological imprint on the brain. How or if depression is treated, or if it can be permanently cured, is completely dependent on the individual's unique set of circumstances.